So for testing the flexion, we ask the patient to bend forward. आगे झुको आप, जितना झुक सकते हो. So a normal healthy person may be able to touch the floor or touch his toes like this. But sometimes if somebody is not very flexible, then even if somebody is able to reach between 7 to 10 centimeters, ideally between 10 centimeters of the ground, or able to reach up to the middle part of the tibia, that should be taken as normal. So when we do like this, there is flexion at both lumbar spine as well as at the thoracic spine. So majority of the flexion occurs at the lumbar spine, but some of it is contributed by the thoracic spine as well. So when the patient is doing this movement, the muscle which acts primarily is rectus abdominis muscle, which is supplied by the intercostal nerves. Similarly, we test for the extension. So for that we ask the patient, ऐसे पीछे हो जाओ. Now important thing here is that the hands should be freely hanging and the patient should not try to do this movement. This is wrong if patient is trying to doing an exam. Hands should be freely hanging. So when the patient tries to do like this, normally the amount of extension that we get is around 30 degrees. And for measuring this, we measure this extension with regard to the vertical. Like if there is a line vertically drawn here, then this angle is around 30 degrees. And this movement is primarily done by sacrospinalis and quadratus lumborum. Now for testing the lateral bending of the spine, we ask the patient to bend sideways like this. And we see what is the gap between the tip of the fingers and the floor. We measure this gap on both the sides and compare it. Second method is we see if the patient's finger are able to go past the knee. In majority of the situation, the patients, even normal patients, are able to make the fingers reach up to the popliteal fossa. But if somebody is flexible, he might be able to get his fingers past the knee itself. The third thing that we can do, or the third way of measuring the lateral flexion is, you ask the patient to bend like this, and then from the back, पीछे घूम जाओ, आप साइड में बेंड करो, and from the back, you measure the angle of his spine with that of the vertical. So this angle should be around 30 degrees. So there are three ways of measuring the lateral flexion. That is when you measure the spine angle with the vertical, when you measure the distance between the tip of the finger and the floor, and third, whether the patient is able to reach past his popliteal fossa or not. So now coming to testing the rotations of the thoracic spine, we ask the patient to place both the hands over the iliacus like this, and we ask the patient to rotate the upper body. जितना rotate कर सकते हो maximum, उतना rotate करो. Now how do we measure this rotation? We see the axis of pelvis. Basically, pelvis axis would be like this, and the axis of shoulder axis be like this. So normally the angle that is formed between these two axes should be around 40 degrees.